Hi everyone, welcome to PharmaExplora. In our last two episodes, we discussed about routes of drug administration, or in simple terms, the methods that drugs are entered into our body. So in there, we divided these routes of drug administration into three main categories: the enteral route, the parenteral route, and other specialized pathways. This enteral route we define as the route of drug administration which involves the gastrointestinal system, and we further divided it into three main methods: the oral route of drug administration, the sublingual route of drug administration, and the buccal route of drug administration. And in our last episode, we discussed about the oral route of drug administration. So we define what is oral route of drug administration, what are its key advantages and the disadvantages, and also the solutions or the special type of formulations developed by pharmaceutical scientists to overcome challenges faced during the oral route of drug administration. And if you miss these videos and if you want a quick refresher, I have put the link down below so you can go through those videos as well. Now, let's think about this. What if you need a day-to-day medication to take an emergency which should be work within minutes? And also, what if a particular medicine is completely destroyed by the stomach acid, or also highly degraded by the liver? So today we are going to discuss two brilliant shortcuts fall within this enteral category as an answer to these questions. So those are sublingual and buccal routes of drug administration. Now, this sublingual and buccal routes of administrations providing the convenience of the using the oral cavity as the method of drug administration. But at the same time, they completely skip or avoid the harsh environment in the stomach, as well as heavy degradation happen in the liver, or in more pharmacological terms, the first pass metabolism. Thereby, those route of administrations provide this high speed of rapid onset of action or the quick action, as well as the high bioavailability or the amount of drug reached to the bloodstream in its intact form. So these routes provide the high speed of rapid onset of action as well as exceptionally high bioavailability. So without further ado, let's start today's discussion about sublingual and buccal routes of drug administration. Okay, before we move into the clinical benefits of the sublingual and buccal routes of drug administration, first let's discuss about what are the sublingual and buccal routes of drug administration are, and also where they're placed in our mouth. So when it comes to the sublingual route of administration, the medication is placed under your tongue. And when it comes to the buccal administration, the medication is placed between your cheek and gum. So when it comes to the sublingual, you place the medicine under your tongue, and when it comes to the buccal, you keep the medicine between your cheek and gum. Now you can see the anatomical placement of the medicine is slightly different, but underlying physiological mechanism is exactly same. So we can say when it comes to the sublingual and buccal administration, the anatomical placement anatomical placement of the medication is slightly different. Why? Because in sublingual you place the medication under the tongue, and in buccal you place the medication between cheek and gum. So this is slightly different, but when it comes to the underlying physiological mechanism, it's exactly same. When it comes to the underlying physiological mechanism, it's same. So let me repeat it again. So here we discussed about the sublingual and buccal route of drug administration. In sublingual, we place the medication under the tongue, and in buccal route of administration, we place the medication between cheek and gum. So you can see the anatomical placement is slightly different, but when it comes to the underlying physiological mechanism, it's exactly same. Now let's discuss how. Now this oral cavity is lined with a thin, highly vascularized mucosal membrane. Our entire oral cavity is lined with a thin, highly vascularized mucosal membrane. So it's lined with highly vascularized mucosal membrane. So what will happen when you take the medicine either of these routes? Once you take the medicine either sublingually or buccal administration, what will happen? The medication will dissolve in your saliva, and the active drug component will be absorbed to the rich underlying capillary network through diffusion by, by diffusion through this mucosal membrane. So once you take the medication, either one of these through routes, so medication will dissolve in your saliva, and uh, it will enter into the rich underlying capillary network through this mucosal membrane by diffusion. Then eventually, it will go to the systemic circulation, completely bypassing the gastrointestinal tract. So this completely bypass gastrointestinal tract and enter into the systemic circulation. So that is the underlying physiological mechanism. So let me repeat it again. Our oral cavity is entirely lined with a thin, highly vascularized mucosal membrane. So once you take the medication under one of these routes, the sublingual or buccal, what will happen? The medication will dissolve in your saliva, and the active drug component will be enter into this rich underlying capillary network by diffusion through this highly vascularized mucosal membrane. Eventually, this medication will reach to the systemic circulation, the entirely bypassing the entire gastrointestinal tract. So this is a brief overview about the sublingual and buccal routes of drug administration. Okay, in sublingual and buccal administration, the drug is directly enter into the systemic circulation through mucosal capillaries. Therefore, these routes provide distinctive advantages. Now let's discuss one by one. The first one is ease of administration. The ease of administration is the similar to the oral route of administration, we use the oral cavity. Therefore, the method is very convenient, it is very non-invasive, and also in our normal day-to-day life, we can use this route of administration. So, the ease of administration is the first advantage in this sublingual and buccal administration. Then the second one is the rapid onset of action. And In our previous episodes, we discussed the rapid onset of action means how quick the action of the particular drug is. So now here we use the mucosal capillaries to absorb the drug. Therefore, the absorption is rapid. There is a rapid absorption which translates into the very fast onset of drug action. So, as we are using mucosal capillaries to absorb the drug, the absorption is rapid and it translates into the very fast onset of action. So, the onset of action means how quickly your drug starts to work. So, here we have a very fast, rapid onset of action. Why? Because the rapid of absorption through the mucosal capillaries. So, one good example is sublingual glyceryl trinitrate to relieve the chest pain in angina attack. Sublingually using glyceryl trinitrate to relieve chest pain in angina attack. I think you may have heard this. The glyceryl trinitrate is prescribed to keep under the tongue when there is a chest pain in angina attack. This angina attack is a severe chest pain happen when there is a less supply of oxygen rich blood into heart muscles. So now if you are using this sublingual glyceryl trinitrate, now you know why you keep it under the tongue. Now our third advantage is bypass harsh gastrointestinal environment. Bypass harsh gastrointestinal environment. We know our gastrointestinal tract developed to the digest our food. So in the stomach we have very low gastric pH or the acidic environment, and also we have very aggressive digestive enzymes to digest our food. So the stomach environment is very harsh. Therefore, when we take the medicines orally, we swallow it. When it goes to the stomach, most of the medications are destroyed by this, the low gastric pH or the acidic environment, as well as digestive enzymes. So, the medications absorbed into the bloodstream will be significantly less. Therefore, since the sublingual and buccal route of drug administration do not go through the normal gastrointestinal tract, it bypasses the harsh gastrointestinal environment. Therefore, the bioavailability of these particular medications are very high. And also the fourth one, the avoidance of first pass metabolism. In our last lecture, in detail we discussed what is the first pass metabolism. The first pass metabolism is when we take the medicines orally, all medicines, before it enter to its normal systemic circulation, it has to go through this portal vein into the liver. So when it goes to the liver, in liver, the liver act as a gatekeeper and highly metabolized and degraded in the liver these drug molecules. Therefore, the drug molecules enter into the bloodstream in its intact form will be significantly less. The sublingual and buccal routes of drug administration avoid the first pass metabolism as well as the gastrointestinal environment, very harsh environment. Why? They are directly absorbing from mucosal capillaries. So therefore, it makes the drug's bioavailability exceptionally high. So these are the four main advantages of this sublingual and buccal route of drug administration: the ease of administration, the rapid onset of drug action, bypassing the harsh gastrointestinal environment, as well as avoiding the first pass metabolism, therefore making the bioavailability of the drug is significantly high amount. So these are the benefits of these routes of drug administration. Okay, to wrap up, today we discussed about the sublingual and buccal routes of drug administration. So in here we discussed what is the sublingual and buccal routes of drug administration are, and what is the physiological mechanism behind that, and also the key advantages of two routes of administration. And to conclude, we can say even though we use the same oral cavity to administer drug, this sublingual and buccal drug administration method provide significant advantages over our oral route of drug administration. So I hope you learned something from this video, and if you find this video helpful, just hit the like button and subscribe our channel and stay tuned for our next session. So thank you very much for joining with Pharma Explorer today, and see you soon.